because a significant number of people with COVID-19 will not have symptoms and the virus can be spread before people with the virus develop those symptoms. The most important information is for us to stay at home. That is where the stay-at-home requests or recommendations are coming from our government and from health officials. Recently, the CDC came out with a recommendation saying that in public settings where social distancing is difficult, if not impossible, like if you're going to the grocery store or the pharmacy, a cloth mask is probably a good idea and will help to keep you from passing viruses out into the environment and also from picking them up.
My medical background is I'm a registered nurse as well. I started off as a medic in the military when I was 17, and then I became a registered nurse and I worked pediatrics, geriatrics, emergency, combat medic. First, I want to explain social distancing is not the same as distancing yourself from society as a whole. It's really, we should call it physical distancing because we can still be sociable like we're doing right now. When there's an order by the governor or the mayor to shelter in place or stay at home, it's a legal order for citizens to stay home so that we can save lives by not being carriers or transmitting the coronavirus. The interventions that we do now are so important to buy us time to prevent a surge of hospital capacity. If the hospitals are overwhelmed with coronavirus patients, then somebody with a heart attack won't survive. They won't even be able to get in. Somebody with a stroke, somebody with an asthma attack, somebody who has an accident, a car accident, their likelihood of surviving is decreased drastically because the hospitals will be so overwhelmed. So that's why it's so imperative that we take seriously this physical distancing, to stay at home and sheltering in place so that we don't spread the virus and cause more untold deaths and illness.
Following this shelter-in-place request, not only for our own protection, but for the protection of others.
I think that we would have mitigated a lot of this if that we had a plan in place prior to this and we implemented that plan.